I want to thank you all for joining us for integrating supplements into your treatment plan, how and when to use them. Presenting in just a few minutes will be Dr. Julia Albright. Dr. Albright is a diplomate of the American College of Veterinary Behaviorists and associate professor at the University of Tennessee College of Veterinary Medicine. Dr. Albright obtained both a master's degree in experimental psychology and DVM from the University of Tennessee before completing a residency and fellowship in animal behavior at Cornell University CVM. Dr. Albright's research interests include reducing stress in animal facilities, psychopharmacology, and the human-animal bond. Today's webinar is hosted by Fear Free Pets, where we take the pet out of petrified and the treat back into treatment. Fear Free's mission is to alleviate fear, anxiety, and stress in pets by educating the people who care for them. You can follow us on Facebook and Instagram at Fear Free Pets. And for any pet parents in the audience tonight, we have Fear Free Happy Homes. And you can find us there on social media at Fear Free Happy Homes or at fearfreehappyhomes.com. Tonight's webinar is brought to you by our friends at Purina Veterinary Supplements. As a thank you for attending, you can use the code supplements20 for 20% off your Fear-Free veterinary certification membership or renewal. I'll also go ahead and put that code in the chat box shortly. For anyone just logging in, I want to welcome you to integrating supplements into your treatment plan, how and when to use them. As a reminder, there are two options on your Zoom controls, a chat feature as well as a Q&A feature. We'll have time at the end to address questions from the audience, so if you have a question, please use the Q&A box. A recording of tonight's presentation will also be available for all attendees within 2 weeks. Dr. Albright, we're so excited to have you here with us tonight, so on that note, I'll pass it to you and we'll get started.
Thank you, Nick. Well, welcome everyone. It looks like we have a great crowd tonight. Thank you for joining us for this webinar on using dietary supplements to improve the health, well-being, and compliance of your cats and dogs. And thanks again to Purina and Fear Free for making this happen. So an overview of the presentation. We'll first start with a quick chat about what is a dietary supplement, but we'll spend most of the time talking about how dietary supplements can be used to treat health conditions such as fear, anxiety, stress, or FAST, gastrointestinal dysfunction, osteoarthritis pain, and dehydration. And then we'll conclude with some thoughts about resources that we can use to accurately communicate between the vet healthcare team and pet owners. So I'm guessing we have a pretty diverse audience tonight. A lot of this is geared towards the vet team side, but I've tried to gear it that everybody can get something out of this. So let's start with a definition of what a dietary supplement is. So according to the now defunct North American Veterinary Nutraceutical Council, and I'll just read this off the screen, a dietary supplement could be defined as a non-drug substance produced in a purified or extracted form and administered orally to provide agents required for normal body structure and function with the intent of improving health and well-being of an animal. So that's a very definition-y definition, huh? So one thing that is not included in the definition of a dietary supplement is a legal definition. So that's just sort of a guideline from a group. And it's important to know there's no FDA approval or regulation of these supplements. Companies usually notify the FDA when they're putting a product on the market, but that is not to be confused with regulation or any sort of licensing. So what that means is there really is sort of a buyer beware, skeptical attitude we all should be taking about dietary supplements in general. And unfortunately, we have some studies to sort of back that up. One group took some probiotics, which are live bacteria, and out of the 15, only 4 of the 15 had met the viable bacteria levels that the label claimed. And then a cannabidiol study, a CBD, this group took 25 products, and only 3 of the 25 were within 20% of the label claim amount of CBD in the product. So what does that mean? Does it mean that we should all just throw up our hands and walk away from this? And the answer is no. There are some ways to ensure we're giving a safe and effective product to our pets. And so for the veterinary team out there, but also for pet parents, one thing you can do is question your reps, the company reps, about data that they have to back up that the label concentrations are accurate for the end of the shelf life, not just the beginning. And that's particularly true when we're talking about live products like probiotics. Do they have published data, hopefully controlled, placebo-controlled data, supporting their efficacy claims? And there's a reason why the trusted veterinary companies are trusted veterinary companies. We as the vet team, we really do feel like we can trust that companies like Purina, Royal Canin, Hills, Vetiquinol, Verbac, we trust that they are putting quality ingredients into their products. And bad news travels fast. So if there's a quality control issue, they know that they're going to hear about it from us. But last but not least, there is this seal you can look for. You can see down here at the bottom right. It's called the National Animal Supplement Council. And so this is a completely voluntary organization. And many of the big vet companies, their products do have this seal. But what they kind of promise to do is get their ingredients from responsible suppliers. They promise to open their product up to third-party testing, and they agree to adhere to some responsible claims and labeling. So that's those are a few things you can do to make sure you're at least getting a safe product for your pets, if not a quality product, or one that is going to be effective for conditions. So let's start talking about those conditions now that we tend to use supplements to treat. So fear, anxiety, and stress are FAS. So let's make sure we all can recognize fear. So that may look like, pacing, trembling or shaking, whining, other vocalizations, escape attempts, sort of like that guy at the bottom left. But don't forget that fight and flight are two sides of the same fear coin, as it were. So this guy is also quite fearful. So growling, barking, snapping, biting, those are also signs of fear. So we know there's both a direct and indirect link between the emotional and physical states of the body. So pain and discomfort can directly cause issues. Think, aggression when you touch a painful part of the body, or an animal that's causing injury to an itchy part of its body. But also indirectly, whenever we don't feel well, or whenever our pets don't feel very well, that can also change tolerance and threshold levels for often unrelated stressors. So in other words, if we or our pets are feeling ill, we often react negatively to something that would not have bothered us during times when we're feeling good. But likewise, the other direction here, how can a psychological stressor cause a disease state? When we are feeling stressed and the stress response is triggered, oftentimes those neurochemicals, especially inflammatory cytokines, they can exacerbate or even create disease states in other systems. So as a veterinary behaviorist, I know that it's important for a diagnostic and treatment approach to be holistic. And we need to assess all conditions that could be knocking the body out of homeostasis or out of good health. So as a minimum database, we of course want to do a good hands-on physical exam whenever possible, blood and urine analysis, but also, good history about what's going on at home, husbandry, behavior, video when safe, using some assessment tools. And we often do trials of pain medications or GI medications as well to see if that can improve behavior. So it's really important that we're all on the same page in recognizing FAS. And Fear Free is certainly a leader in these materials. So over here on the right, we have the Fear Free FAS scale. I bet everybody here has seen this. I hope that everybody's using it in the clinic and using it as an educational tool. This is that 0 to 5 or green to red, where the bottom is our relaxed animals and the top are our sort of terrified animals and the ones we need to do the most to bring that FAS score down. But I also love, on the left is a screenshot of a video that you can find on Fear Free Happy Homes. I send, every cat and dog owner to the respective videos. There's the link below, and it really sort of brings the FAS scale to life. So it's got video, it's got corresponding live cat videos to sort of go with each of these FAS scales or FAS levels over here on the right. Purina also has a version of this. We created a slightly different scoring method with body language diagrams and also descriptions. And then also the screening tool that the cat's family can provide a score for typical events that the cat may experience throughout the day. And this is not a validated diagnostic tool by any means, but it's intended to start that conversation between the cat's family and the vet team. And if you're part of a vet team here tonight, you can ask your Purina consultant for this as a tear-off pad, and they'll be glad to get you one. And I also have a QR code at the end of this presentation that you can scan and download both the cat and the dog version of this. So let's not forget our dog friends here. A FAS scale that mirrors the one that I just showed you for the cat, and likewise Purina. We don't have the diagrams, the body language diagrams, but we do have the body language descriptions and a screener tool that, again, not diagnostic, but can help start that conversation and help the pet parent and the vet sort of recognize how severe and intense and pervasive throughout the day stress may be in that cat or dog. So let's start talking about the treatments a little bit more. So we already mentioned we really want to assess the whole animal and we want to treat the whole animal. But once you identify triggers for FAS, we behaviorists sort of have 3 big prongs to our treatment plan. The first is going to be controlling exposure to those triggers, particularly outside of your behavior modification sessions. So really that's going to include a lot of avoidance of triggers. Practice makes perfect, and let's not practice the unwanted behaviors and those negative emotional associations. Behavior modification is really the core of the treatment plan. We're creating not just a different behavioral response, but we want to work from the inside out and create a better emotional response to those triggers as well. And then our therapies, like pharmaceuticals and behavioral supplements, they really can help us make all that happen a little bit better. And at times are needed to really improve the welfare of that cat or dog. So pharmaceuticals and supplements are a core of our FAS treatment. So pharmaceuticals we think of as those prescription medications, the antidepressants, are rapid acting anxiolytics. But then the dietary supplements, we're going to spend the most time talking about here. And then adjunctive therapies. I kind of think of pharmaceuticals and supplements as something you put in the dog to work from the inside out, the dog or cat, whereas adjunctive therapies like pheromones or calming scents, pressure wraps, white noise, these are all tools that sort of work from the outside in. And the supplements and adjunctive therapies are usually not heavy hitters. They're not going to make huge differences alone in a lot of our patients with high FAS. But before we move into that, again, just want to emphasize that we really need to treat all aspects of the pet. We want to identify all health concerns and at least address them. Because even if they're not causing the behavior problem, we really limit even our behavior treatment plan if that animal is not feeling very well. So when would I reach for a supplement over a pharmaceutical? There's a couple of reasons. One is if we have, a patient experiencing just mild fasts, or, only fasts in certain situations. That might be a case where we reach for one of these more mild fast supplements, dietary supplements. Also, because they're not our heavy hitters, they tend to have low side effects. So if I have a senior pet, or I have a pet patient that I'm working with that's got kidney disease or liver disease, I'm probably going to explore my supplements first for those lower to moderate fast scores. Probably the most common way that I use supplements in my practice is in combination with my pharmaceuticals. For example, we've got them pretty stable on a pharmaceutical regimen, but we feel like we need just a little bit more, either all the time as a maintenance or baseline medication, or for specific events. That's when I might reach for a supplement instead of increasing the dose of a pharmaceutical. And then we want to meet all patients and pet parents where they're at, right? So if they're really not sure about a pharmaceutical, even if I think that's the best thing, at least I've got something to offer them if I feel like that patient really needs some anxiolytic help. And then last but not least, a medication or a supplement is only as good as the amount that you can get in that patient, right? So I got the picture of this cat here looking at this pill, like, no way. So that's really where our supplements come in, particularly for our feline patients. Some of these are particularly tasty, and I'll often use as a food additive, a palatability motivator, even if they're not particularly anxious. But that said, let's talk about some of the common ingredients for some of our anxiolytic supplements. So alpha-casozepine, that is a milk-derived protein, and the thought is that it enhances GABA. So GABA stands for gamma-aminobutyric acid, and that is our major inhibitory neurotransmitter of our central nervous system in our body. So if we enhance that, it has sort of a relaxing effect. L-tryptophan is a precursor for serotonin. Serotonin is what a lot of our antidepressants are increasing and improving mood and decreasing stress. Interestingly, stress eats up serotonin a little bit faster than the other, normal body system pathways. So by giving tryptophan, you're helping, supplement that and potentially help that antidepressant work better. L-theanine is a green tea extract. DA stands for dopamine, serotonin, GABA, glutamate is if GABA is our major inhibitory neurotransmitter, glutamate is our major excitatory neurotransmitter. So by decreasing glutamate, that may also have a calming effect. So depending on what paper you read, L-theanine may affect several of those neurotransmitters. Magnolia and philodendron plant extracts seem to work together synergistically, and probably also enhance GABA, potentially some other calming neurotransmitters. Omega-3 fatty acids, particularly we're looking at EPA and DHA in those products. Those have anti-inflammatory effects. And I mentioned a couple of times that any stressor, psychological or physical injury, can trigger the inflammatory pathway, and that's part of the damage of stress. So anti-inflammatory products can actually be helpful as anti-anxiety products, or at least minimize the damage from anxiety, from the stress response. And then probiotics, they're sort of an interesting new class and space in the anti-anxiety world. So Bifidobacterium longum in particular probably decreases anxiety, we think, by decreasing the gut-brain, affecting the gut-brain axis. And I'll be talking about that more in just a second. But first, I wanted to mention some of the products that we trust that contain some of those ingredients. And again, this is not exhaustive. I don't want you to think these are the only products we use. But I picked these because they're from companies we trust, and they also have papers. They have controlled, usually oftentimes placebo-controlled blinded studies that also sort of support their claims. So anzatane is an L-theanine product, a single ingredient by Virbac. Vetiquinol makes Zelkine, that's an alpha-casozepine single product. Soliquin is a combination of the philodendron, magnolia, and L-theanine. Composure is primarily an L-theanine. It has some other proprietary ingredients that VetraScience says is anti-anxiety as well. So let's talk a little bit more about sort of the probiotics. But first, before we do that, I need to introduce some terms. So the microbiome is all the organisms in an area, often called the microbiota, and their environment. So those two things together, we call the microbiome. And I have this chart on the right to show you that, most these organs and areas and systems seem to have a distinct normal microbiome, but the gut has been studied the most so far. So let's chat a bit about the gut-brain axis. So this refers to a bidirectional communication between these two organs or systems. So emotions and cognition can influence GI function, but in the last few decades, a whole lot more data and research has been coming out about how the gut, in particular, the microbiota, can influence brain development, emotions, cognition. And we know that this axis works through integration of the nervous system, the endocrine system, and the GI system. And it's really the microbiota and their products that are the mediators of this bidirectional axis. So just a little bit more before we start talking about the products. So if we talk about sort of the brain-gut direction, stress can activate the fight or flight response. And I've mentioned this a couple of times already, but that's the sympathetic nervous system. The output of that is epinephrine and norepinephrine, and then the adrenal gland creates cortisol, and then the inflammatory pathway is set off as well. So when gut cells, when these pathway and these neurochemicals can affect the gut cell, and when they become inflamed, they become more permeable. So water and fluid can enter. That's when diarrhea occurs, cramping, bloating, bacteria can be translocated across the gut barrier there. So, and also the stress can create an environment in our gut that is actually more favorable to harmful bacteria growing and less favorable to the beneficial bacteria growing. So this can exacerbate problems. And we call that state dysbiosis, when we have more harmful, the balance of harmful is favoring the beneficial. And that's actually been linked to a myriad of disorders, everything from neuropsychiatric disease like Alzheimer's and Parkinson, IBD, diabetes, cardiac disease. It's just, this is a really flourishing field right now. Causation has not really been shown yet. They're just showing sort of the link right now and the correlation. But more and more as we're finding out about that and potentially being able to treat this dysbiosis as one of our treatments for the disease, or at least the clinical signs associated with it. But, let's look at the other direction as well. So the microbiota products can affect the nerve, in particular, a very important large nerve called the vagus, or by the products of the microbiota actually diffusing directly across the blood-brain barrier. In particular, the short-chain fatty acids, which I have here as SCFA, they are thought to be the products that are the major chemical mediators of this gut-brain communication. And in fact, that's why I have up here, the title of the slide is actually the gut-brain microbiota axis. That's what you're going to see it referred to the most in the literature now. So these short chain fatty acids, they support the production of those beneficial neurotransmitters like GABA, serotonin, and other mood and anxiety influencing chemicals. And this may be a major mechanism of how our body or anxiety is reduced and our body becomes resilient in the face of stress. And just as an aside, the microbiota has also been shown in newborns to influence how the brain is developed. And also the healthy microbiome has been shown to support the immune system. So much coming out of this. I know that's kind of all over the place, but the data is really fascinating. So let's talk about probiotics. These are the living microorganisms that convey a health benefit to the host when ingested. So basically, we're trying to take advantage of this, trying to treat dysbiosis, and also trying to take advantage of that gut-brain axis. So how does it work on a gut level? The probiotics, we think, are effective by one, crowding out pathogenic bacteria so they can't adhere to the cells, to the gut cells. They also secrete antimicrobial and anti-inflammatory factors, and making it more, decreasing those harmful bacteria and making it more favorable for the beneficial bacteria in the gut, and then also enhancing and strengthening that gut barrier. So Purina Calming Care is one probiotic product, and it contains Bifidobacterium longum 999, which has been associated with less anxious behavior in many laboratory species. And in a Purina study, and in the canine study, their dogs fed Calming Care for 6 weeks had a lower reactive fear response to several fearful stimuli or fear-producing stimuli like noise, stranger approach, separation from their caretakers, compared to times when they were fed a control diet. And again, this is a very palatable option, particularly for our cats. So this graph is a study. Again, it's the same Bifidobacterium longum 999. And on the right, we have a graph here from Dr. Michael Lappin at CSU and his laboratory cats who happen to be infected with feline herpes virus. And if you're not aware, herpes outbreaks, so the sneezing, the goopy eyes, all the upper respiratory signs, those have been linked to, those outbreaks have been linked to stressful situations. So what they did is they put these cats under slightly mild stressful conditions just by changing their housing. And when they were fed the Calming Care instead of the placebo, you can see that they had increased contact seeking behavior. They had less pacing behavior compared to control. They had less common was to have the elevated cortisol. And you can also see here that sneezing was much lower. So we can say that there's evidence for both lower or fewer behaviors indicative of stress, but also the morbidity associated with the herpes was less as well. So that was kind of a cool study. But what about probiotics for GI disease? As mentioned before, probiotics can reduce inflammation, improve the gut barrier, decrease for the ability of harmful bacteria to colonize the gut. So Enterococcus faecium, SF68, is one of these beneficial bacteria. And research has shown that in shelter dogs and research dogs, one very helpful place for these products is when used in conjunction with antibiotics, which are known to cause diarrhea in quite a few of our pets. So the dogs that were fed metronidazole and this probiotic, they had fewer days of diarrhea, and cats, when they were on the amoxicillin clavulanate, also showed fewer days of diarrhea when on this antibiotics. I think we could all benefit from lower flatulence in our dogs, and that has been associated with this product. And then in a separate study, I thought it was interesting, these shelter kitties that were fed this Enterococcus faecium had a lower incidence of diarrhea and also higher immunoglobulin A, which is some evidence that probiotics may strengthen the immune system as well as directly affecting the gut. So some more evidence about this immune enhancement. Increased T cells in some cats. Again, cats fed not just the calming care, but also the fortiflora, the Enterococcus faecium. They also had decreased morbidity associated with their feline herpes virus. And then in 2 different studies showed that dogs fed this product had increased IgA and IgG. Those are products, those are immunoglobulins, part of our immune system, for those of you not familiar with these terms, as well as B cell priming in puppies given the distemper vaccine. So if you put all these together, it looks like they might have an immune enhancing response as well. And so all those studies were done with Purina Fortiflora, and this is Enterococcus faecium SF68, available for both cats and dogs. But before moving on, I want to introduce the term prebiotic as well. So many probiotic products out there also now contain a prebiotic. And this is a carbohydrate that is fermentable but not digestible by the host organism. And think of it as, the microbiota can use this fermentable product. And it's essentially like having food along for the ride with the probiotic. So the probiotic with its lunch. So we call those symbiotic products. So the prebiotics with the probiotics are a symbiotic product. That was a lot of P's. And so Purina Fortiflora Pro, again, some additional studies with those have been shown to improve fecal score in some dogs. And interestingly, a group of sled dogs that were infected with a diarrhea causing agent, they had lower, those fed the this product, the Fortiflora Pro, had lower prevalence of diarrhea in those dogs. Other products are symbiotics as well. ProViable by Nutramax is a very common product. It has 7 strains of bacteria along with the prebiotics for, again, a sort of food for those probiotics. Some interesting studies with these as well, done here at UT actually, to show that these products, when given, these studies in particular, were looking at antibiotic-induced diarrhea or GI signs associated with it. And dogs that were on both metronidazole and enrofloxacin had better long-term appetite and fecal scores compared to those not fed ProViable Forte during that time. And cats on clindamycin had less vomiting and a better appetite when given this product along with the antibiotic. So switching gears a little bit here, let's move away from the GI a bit and onto joint health, which is probably one of the most common and well-known and maybe most well-established spaces for dietary supplement treatment. So just make sure we're on the same page. Osteoarthritis is a degenerative condition of the bone and joint and cartilage. And here on this radiograph, you can see some really severe bone remodeling here in a dog with hip dysplasia. So that instability creates all of this bony growth and damage to the joint. And then clinically, what you'll see is pain, stiffness, decreased joint mobility, and range of motion in these dogs and cats. So non-steroidal anti-inflammatories are still the mainstay treatment for pain and inflammation in these guys, along with physical therapy, decreasing that body conditioning score, getting that weight off these guys. But, you know, there's always concern about long-term administration of NSAIDs. So there are many chondroprotectant supplements out there to protect the health of the cartilage and the surrounding bone and to help promote joint lubrication. So glucosamine, chondroitin sulfate, hyaluronic acid, omega-3s. Again, we're looking at the EPA and the DHA in particular for their anti-inflammatory effects. And, you know, the research, if you look at the meta-analysis, not all the studies have shown that these are helpful, particularly particularly when used alone. But just like any supplement, I think they're more helpful as part of a multimodal plan. And we certainly use them a lot around here. So what products are we talking about and which ones do we trust? Again, I know that there are tons of products out there and there are probably some very good ones not up here on this slide, but these are from the trusted veterinary brands and most of them have controlled, if not placebo-controlled studies to go along with that and to back up their claims. So we've got Purina's Joint Care. We have Movaflex, Cosequin and Dasequin. These are some big players in this space. So I have the asterisk there for the Dasequin. It has an additional anti-inflammatory product called the avocado, or the ASU is the avocado unsaponifiables. It's another anti-inflammatory product. And then Glycoflex from VetraScience. Instead of using a fish oil, they have a green mussel, EPA and DHA as well. So again, very common products here. Other analgesic, purported analgesic products that aren't necessarily in those chondroprotectant products. There's Duralactin by PRM Pharmacol is used quite a bit. This is a milk-based protein, again, with some anti-inflammatory effects. You'll notice I've not talked very much about CBD. I know it's the kind of the darling of the supplement world right now. But Elevet does have a study out, and I've got those references on another page if you would like to check those out. But that Elevet is a CBD product, and again, has been shown. It was one of the first products to show improved lameness scores and pain compared to controls. So now moving completely away to another popular area, which would be hydration support. And this is the last condition we will talk about for tonight, and then we'll take some questions. So when do you want to reach for hydration support? So cats, let's talk about them a little bit here. So whenever we have fluid loss, so polyuria is quite a few conditions can cause that in cats. So kidney disease, hyperthyroidism, diabetes, just to name a few. Anything that results in diarrhea could potentially cause excess fluid loss and dehydration. Any inflammatory GI disease. Other things we may not think about, excessive licking and from over grooming or dermatologic disease may create concerns. But also maybe not so much they're losing the fluid, but if they're not taking in enough fluid. So some conditions that might contribute to that, osteoarthritis or anything that can decrease mobility, anything that cat may not want to get up and drink the water. In addition, dental disease, maybe it's painful for the cats to drink. Age-related cognitive decline. They may sort of forget to get up and drink out of that water bowl. But really any condition that causes a vague sickness behavior, again, decreased motivation to actually get up and go get some water and move around. And then, supportive care. This handsome devil here on the left is one of my best friends, and he has a chronic enteropathy. I have his picture here because he is profoundly polydipsic from a constipation and chronic enteropathy. That's his clinical sign that to accompany his chronic enteropathy. but also, if supported care in a cat that might otherwise be healthy, but might be experiencing some constipation or some urinary tract disease. So while they may not be clinically dehydrated, that water may help soften the stool in a constipated cat, or I should say the fluid. And also we're really looking for that dilution effect and that flushing effect in our cats with lower urinary tract disease. So, no doubt about it, canned or moist cat food is a great way to get additional hydration support to our cats. But some of them, a lot of our cats are finicky. They don't like novel food. So we can't get them to eat the wet food. If it's a cat that can handle a higher sodium diet and that's not contraindicated by another health concern, sometimes that can help make them thirstier as well. Flavored water, again, if they don't have some sort of, food sensitivity that we're looking out for, that can be helpful. A lot of environmental management, trying different things for these cats, various locations for water bowls. I've discovered with my cat that really having, lots of water bowls, particularly in common pathways, has really been helpful. Various sources. We all hear about running water versus still water, various bowl sizes, material, heights, temperature, all of those things are worth experimenting with to see if your cat at that moment or your patient, we can get them to consume and be interested a little bit more in the water. But now we have additional help through Purina HydraCare. This is a nutrient-enriched water. It has glycerol and whey protein and liver flavor. It's very palatable, and it can stimulate thirst. So not only does it motivate them to consume this water product, which in and of itself can add to the fluid intake of the cat during the day, but it might also stimulate them to drink more of the still water that's available throughout the house, or moving water, whatever, the tap water, I should say. And studies did show that cats on this product did consume about 50% more liquid compared to when on just dry food or tap water alone. And they started to show effects as soon as 2 weeks. It was the first time they started looking at it, all the way up to 2 months. So they did maintain that hydration. And then the output that we're looking for, the urine was more dilute and a higher volume. So we did get sort of that flushing and diluting effect that we were looking for with those cats. All right, so before we finish up, I did want to point out some resources that we can all be on the same page with, be it really any sort of condition, not just the supplements. So the Purina Institute is a great resource. And on that, you can look, and I have the link here for Center Square. This is a wonderful resource where I took some screenshots here because it would be too hard to toggle on and off for this webinar. But this is, you can see over here on the left, it's got lots of options. And so let's say you clicked on the therapeutic nutrition and went and looked at something, say, canine cognitive dysfunction syndrome. It's going to give you a quick introduction, key messages to talk about from the vet team and the pet parent, conversation starters, and then additional tools. And these tools are product agnostic. They have papers, any paper, or science behind the issue. This is a great summary to talk with them about. I use it in my clinic, that's for sure. So here are some of those references that didn't quite fit on the slide for some other products. And I'm sure you can go back and look at those from the webinar if you didn't have time and were interested. But here are, if you want to get your phone out, and if you are interested in any of those Purina fast screeners that I was mentioning earlier in the talk, here they are. And that is the end. I'll turn it back to Nick here.
Great. Thank you so much, Dr. Albright, for that
You are
wonderful
welcome.
presentation. We do just have a few questions from the audience. Let's go ahead and start with, is there any concern combining different probiotics? You mentioned Fortiflora and Calming Care, but what about others?
Combining them, is that what you said?
Yes.
Um, so I would say if we look at the evidence, you probably don't need to do that. I don't think there's a problem doing it. It's just, I don't think there's any evidence that combining two, especially two GI products like that. And I'm sorry, I think I might have misheard. Did you say Calming Care and
Calming Care and Fortiflora.
oh, gotcha. Sorry. So those are very different. No problem combining those at all. I do it all the time.
All right.
Because they're very different.
Or no, I apologize. I'm confusing myself now. So there's no concern about combining Fortiflora and Calming Care,
No.
but the question was just generally about probiotics.
Right. So if you're looking for two GI based, so like ProViable and Fortiflora, I don't think there's any evidence that that's going to be beneficial. But
Okay.
if you're looking for an the bifidobacteria longum, which is a different type, that's not really affecting dysbiosis as far as diarrhea. That's going to be the anti-anxiety effect. So if you want to use both of them together to have the Coccus faecium and the bifidobacterium, no problem with that.
Great. Thank you so much. And on a similar note, someone else was wondering if you recommend giving Fortiflora and Calming Care together.
Yes, so that's what we were just referring to.
Great, thank you. Let's see.
And I should say, if the dog is showing GI signs, diarrhea, or I don't tend to use probiotics for vomiting, sort of upper GI, more lower GI issues. But yeah, if they're having diarrhea and anxious, I would definitely combine those two products, no problem.
Thank you. This one is from Helen. She's asking, with the research papers that that test these products, what are some important things to look for to ensure the study is performed reliably? For example, things like sample size and avoiding cherry pick data, that sort of thing.
It's difficult to sum that up, but I think the thing that can jump out at is make sure it's a controlled study, right? They have a placebo and a treatment phase with the product. Sample size, the bigger the better, but in veterinary medicine, we all kind of put up with low sample size and do the best we can based on that. Yeah, stats can be very confusing, and we're certainly relying on them a lot. But again, I'm looking at least for that controlled data or controlled and treatment phases, hopefully in the same animals, but that's not always the best study design, depending on what they're studying. So at least a control, parallel groups or parallel cohorts.
That makes sense. Thank you. All right, this next question is about probiotics and antibiotics and sort of how those two things factor in with each other. Sorry, there's a few questions here about that. Says, when exactly would we ideally introduce these two? Do you recommend taking them together or only taking the probiotic after the antibiotic treatment is completed?
No, at the same time. That's what those studies were about. I apologize if I wasn't very clear on that while I was trying to summarize them. Yes, those were concurrent antibiotic and probiotic usage. And I believe the probiotic extended past the antibiotic usage as well. I get a lot of questions, and I've asked a lot of questions about timing. Is the antibiotic going to kill the probiotic? And I have heard from the reps that it definitely depends on which antibiotic you're talking about, but 2 hours is sticking out in my mind. We might go back and ask the reps again about that, if that's one of the questions that might filter in. But in my mind, I've been told you're pretty safe if you separate them by about 2 hours.
Great, thank you. This next one is from Grace. Do you think the joint supplement efficacy is influenced by a pet's age? For example, starting a younger dog on a glucosamine supplement versus starting as a senior?
Good question. I don't pretend to be an orthopedic expert, but what I've been told is there's no evidence to show that those are preventative. I think that may be what the question is really getting at. If we start the animal at age 5 on those chondroprotectants, will that prevent? And the answer seems to be no. Weight loss, though, even though it's not a supplement, looking at diet as far as lower calories and weight loss. Purina, the other big companies have great, low or weight loss diets. That's probably the best thing you can do preventatively. But yeah, anytime your vet tells you that they suspect there's osteoarthritis, that's when we get those supplements on board. But I guess there's something to be said that we often are not catching things when they first start. So, if you've got a large breed or giant breed dog, I do that. Maybe not necessarily the most evidence-based, but I've owned some large and giant breed dogs in the past, and they all got, we just sort of started them on it about age 6 or 7.
Makes sense. Thank you. And then I'm seeing a few questions about whether this webinar is recorded. I did just want to let everyone know that a recording of this webinar will be available on fearfreepets.com within the next 2 weeks. So you can keep an eye out for that there. We will also be sending a link to the presentation to all attendees as well. So no worries if you missed part of the presentation, we got you covered there. It looks like we have time for just a few more questions. Let's see. Looks like we're having a few questions about giving human probiotics versus, or whether it is okay to give human probiotics to pets.
Good question. Certainly that has not really been, I have not seen any studies about using things that you would pick up at the drugstore in your own pets. So it's probably safe, but I cannot really comment on the efficacy of it. I think a lot of the same, at least some of the questions can pertain that, is it a good product? Is a product itself a quality product, regardless of what species is consuming it? So, can we find some data to say that at least the label is correct? Is the amount of, or the number of colonies alive what they claim it to be? At least you can look for that data probably online. But the kind of apples to apples, the same bacteria in a pet product or a veterinary product versus a human product. I just don't know the answer to that based on the evidence that's out there. So that's why we stick with the veterinary products.
Absolutely. We have a question about a multi-cat household with something like the Calming Care supplement. Is that in a situation where there is sort of like a quote unquote bully cat? Would you want to give that Calming Care to that cat or the other cats in the household?
I mean, if you've got aggression, of course we'd want to get that properly diagnosed, but the victim cat is probably quite stressed. But we assume that the bully cat is doing this. A lot of people would assume that they're just confidently going about this, but anytime an animal is showing aggression, they're not in a calm state. So that animal may need some anti-anxiety therapies as well, be it something from that your vet prescribes, the supplements, out there. Any of those could be useful. It's hard for me to comment on that case specifically, but yes, as a general therapy, I would not worry about either of those cats consuming that product. But again, please check that with your vet to make sure that's the right choice.
Absolutely. And it looks like we are just about at time for the evening. I want to be mindful of everyone's time. I know it's getting a little late for our East Coast attendees. I did just want to go ahead and say thank you one more time to Dr. Albright. And thank you to our friends at Purina Veterinary Supplements for making today's presentation possible. As a thank you for attending, you can use the code supplements20 for 20% off your fear-free veterinary certification membership or renewal. And then once again, thank you to everyone in our audience for joining tonight's webinar. You can be sure to follow us on social media at Fear Free Pets, and you can also subscribe to our newsletter at fearfreepets.com for invitations to future presentations. We hope you all have a great evening, and we look forward to seeing you next time.